Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. This is Healthy Living Tuesday right here on KUAM. And Dr. Jitka Lom, our very good friend from ExpressCare, is here. Doc, how have you been?
Very well, thank you. Nice to see you.
Nice to see you, too. Okay, so tonight we are talking about hernias, and there's no easy way to transition from how are you doing into hernias. So,
do you have one?
Let's dispense. Well, hopefully neither of us. I have not, and hopefully you haven't either. Have you ever treated someone with a hernia?
Yes, many times.
Okay.
Yeah. What is a hernia? It's basically when a piece of your tissue, your organ, is protruding into a spot where it shouldn't be. So it's poking into an area where it shouldn't be. Typically, we have umbilical hernias. Those are the ones around our belly button. Or after surgery, people can have an incisional hernia. Or the most common kind is the kind that men have, which is down in their groin, going down into the testicle.
Now, for a layman, aka an idiot like me that doesn't understand anything about science, we used to learn that there was almost like a little balloon or something like that within the body that kind of encapsulates all of the organs and everything. And when there's a little break in that, those tend to leak out and everything like that.
Yeah, exactly. I like to think of it like a shopping bag, a Payless shopping bag.
Right.
You've got a little tiny hole in it that's there from birth. These are congenital, meaning you're born with that little tiny hole. And then as you carry the shopping bag around, that's inside your guts, this bag is really called the peritoneum. And as there's more and more pressure on it, the little hole gets bigger and bigger and bigger until something can poke through. In this case, it's not your groceries, it's your intestines. And so at the beginning, it can sort of slide back and forth a little bit like that. As it gets bigger and bigger, then basically it gets very large, and there's constantly something poking out.
Now, when I was in the 10th grade, my health and nutrition teacher told us, and they said, well, the reason you don't want to get a hernia is because it can be somewhat painful, and it may or may not require surgery. So don't go walking up to a manhole cover and try and lift it, or don't lift anything heavy, because you will put a lot of stress on your cavity.
You can't really give yourself a hernia.
Thank goodness.
By lifting something heavy, unless you already have one there. So it's there from birth. The defect, the little hole is there. Now, things that can make it worse are gaining a lot of weight, because that's basically a lot of pressure on the inside of that shopping bag. You're carrying a lot more inside it. Because when you gain weight, you've got fat not just on the outside, but all around your intestines. If you do surgery and you open up the cavity, you'll see so much yellow fat stuck onto all the intestines. And so that bag gets very, very heavy, and things start poking through that they shouldn't.
So are we to believe that probably the number one way of prevention is to keep your weight in check?
Yes, keep your weight normal.
Okay. Yeah. How about for people that, because you said it's something you're born with and everything, for people that have hernias and the hole gets larger and larger, and
then it can be repaired.
Yeah, and so, how typically does it have to be surgical?
Yes, it does actually. They can do it through sort of laparoscopic or keyhole surgery, or sometimes it has to be open.
Which is the non-invasive kind.
Yeah, less invasive. But what happens is that they basically put a mesh over that bag, over the peritoneum, stick it on, and then sew it along, and so that there's a new barrier, so that whatever it is, which is the intestines, cannot come out. So that's a hernia repair, and sometimes this is even necessary on young people, children or young people that have that.
Now, I know when people go through, especially athletes, and they talk about sports hernias, how did those deviate maybe from your garden variety hernia, for lack of a better term?
You're talking about the inguinal hernia, though? Yeah, it's still the same. It's just, what made it worse, perhaps something extreme that athlete was doing, but again, it was there from the beginning.
Then maybe they were pushing something heavy, or they were aggravating.
Maybe heavy.
I've seen a lot of football players have sports hernias.
Right.
Okay. So let's talk about symptoms, if somebody believes that they may have something like that, or how long can you walk around actually having a hernia before
a really
you know
long
about
time. Well, you can walk around a really long time with it. What can happen is people just notice at first a little bulge, usually in the testicle or in the lower sort of, we call it the suprapubic area, just right above the pubic bone. Notice a little bulge that comes and goes, and usually when they strain or push, they'll see that bulge come out, and then it goes away, comes and goes. Usually it doesn't hurt, but they'll alert their doctor or somebody about it. After a while, it starts getting bigger and bigger, and again, it may not push back in, it may just stay there. The worst kind is if it gets stuck. If it comes out, if the intestine comes out and it gets stuck and twisted and it cannot go back in, we call that an incarcerated hernia, and that one needs emergency surgery. But most of the time, hernias can be dealt with electively, meaning at any time that's convenient for you, knowing that they're not going to get better on their own. They pretty much always need a repair. The only caution there is if it's an umbilical hernia that little children have. Sometimes little babies will be born with their belly button sticking out because there's some intestines coming through, and that usually will go away on its own by the time they're age 2 or so.
Okay. Because the repair of hernias, it can be laparoscopic or it can be, where you have to be open. What's the recovery time?
Oh, well, they would be, usually it says in and out day surgery, go home and recover at home. And the recovery time, your sutures would come out in a week, and you'd be back to work usually within a couple of weeks without any heavy lifting, though. Mm-hmm. That's really important for recovery from any surgery on the abdomen.
Okay, well, we have some viewer questions excellent on the topic of hernias, so please stay with us.
Sure.
All right, and you stay with us too.